Hey, welcome back to Not So Complicated, and today we'll be talking about statins. These are hypolipidemic drugs, so let's begin without further delay. So statins like atorvastatin and simvastatin are for lowering LDL cholesterol actually and preventing cardiovascular events like myocardial infarction. So the attached figure in here is actually about the cholesterol synthesis. You can look at that. And the mechanism of action of these drugs is that the statins competitively inhibit HMG-CoA reductase enzyme. This is an enzyme. It is a rate limiting enzyme in the mebelinate pathway. Mebelinate pathway is actually this pathway which is the end product of this pathway is cholesterol. So basically cholesterol synthesis is inhibited by inhibiting this rate limiting enzyme, and this HMG-CoA reductase would actually convert HMG-CoA to mebelinate, but it didn't because it is inhibited, right? So it was a precursor to cholesterol in hepatocytes, so it is not able to form. That is why cholesterol are not formed yet. So also what happens is reduced cholesterol synthesis lowers intracellular cholesterol, right? And then they trigger the liver to upregulate LDL receptors via SREBP activation. This is a homework for you. What is SREBP? And then more LDL receptors on hepatocytes enhance uptake of circulating LDL and intermediate density lipoprotein ideal from plasma. And then statins, in a pleiotropic effect, what they do is that they reduce vascular inflammation, they stabilize atherosclerotic plaques and improve endothelial function by decreasing isoprenoid intermediates. Example, this is a long form organic compound that you don't have to remember, right? Just say that they decrease isoprenoid intermediates in cholesterol synthesis, independent of cholesterol lowering. So these are pleiotropic effects of statin drugs, and physiological and clinical effects that lipid changes happen, that is decrease in LDL about 20 to 60 percentage and decrease in triglycerides about 10 to 20 percentage and increase in SDL because SDL is a good cholesterol about 5 to 10 percentage, right? And clinical manifestations, they decrease the risk of MI, stroke about 25 to 40 percentage and also decrease the risk of cardiovascular mortality, and they improve lipid profiles, reduce atheroma size. Atheroma is a plaque in a blood vessel that causes like thrombosis kind of lesions and fewer cardiovascular events. So let's talk about fibrates and niacin actually. So fibrates, they act on PPAR alpha factor and they decrease triglycerides by increasing lipoprotein lipase enzymes, and in niacin cases they decrease VLDL, that is very low density lipoprotein synthesis, and increase HDL, thus decreasing LDL or TZ. So this is how they function, unlike statins, right? So that is all about today, and subscribe for more. Thank you for staying with me.